November 8, new COVID-19 infections in the Gambia range from 1 to 7 cases per day. The country barely hit 10 or more cases per day in over 3 months, and this has got health authorities in the country response program worried about the low turnout for COVID-19 tests. The CISE has more details of that in this report.
The Gambia is experiencing a very low number of new cases of the coronavirus when other countries have entered a second wave of new infections. Many people in the Gambia seem to lack interest in the government's voluntary testing initiative, and this, according to observers, has led to the massive drop in the number of new cases recorded daily. The coordinator of the Public Health Emergency Operations Center, Epidemiology and Disease Control Unit, Sanasambu, agrees with the notion that the low numbers in new cases is as a result of the low number of new tests.
You see, for a country, if you want to know whether the cases are going down or what is the magnitude of the outbreak and things like that, you can only gauge it by making sure your interventions are working. So, but what we see now is people are not coming out to be tested. And if we are not getting people to be tested, we can actually say what is the level of the virus in the country or the outbreak in the country. People should be tested. And that's what is going to tell us whether the virus is here or not, whether more cases are coming up or not, or whether we are only into another option or not. You can only know this when people are really coming out to be tested. But Gambians are not coming out to be tested voluntarily.
During the start of the pandemic in the Gambia, and with even fewer testing centers, many people were actively taking voluntary COVID-19 tests, especially in the months of June, July and August, when the country reached its peak. But as the government announced the introduction of new COVID-19 testing centers, some of which situated in the heart of local communities, the numbers of people turning out for tests dropped, so as the numbers of new infections. With the mandatory quarantine rules dropped, Sambu says it is important for people to get tested and that they should not be afraid, because if they are positive, then health authorities will find ways to work with them in their recovery process.
We are not going to quarantine anybody as before. We are not going to pick up anybody in the community as before. We will only be picking people who really need care and they need our support. Those people, obviously, if they need, we can force them, but if they need us to pick them up and help them to get treated, we will do so. But forcefully quarantining people and isolating people is not more happening. So let people know this. Just come and get tested. Even if you are positive, we know how to work with you, but we know people from your company. Those days are over. So there is no fear or no whatever that will keep people away from getting tested.
With France, Spain and other European countries experiencing a resurgence of the coronavirus with a high increase in the number of new infections, countries in Africa where the figures have been relatively lower than other continents have yet to report a second wave of new infections. But is the Gambia prepared for new outbreak of the virus? Mr. Sambu again.
Exception, we have been very, very vigilant and very active on the ground and well prepared actually. This preparedness will never be relaxed until we know from the WHO or the global community that the public emergency has been relaxed. But since that is not yet announced, we still have to be very, very active on the ground. And in fact, what we're doing now is just a race. As you go towards the end of the race, you have to adapt your speed to be able to achieve what you want to achieve. We will not say because we have less cases, we're going to relax. No, this is the best time when we are actually revisiting our plans and ensure that we become more stronger than before.
The Gambia began reporting a few new cases of COVID-19 when the number of samples taken daily significantly dropped. As of Thursday, 19 November 2020, the Ministry of Health reported 0 new cases and deaths. The total number of confirmed coronavirus cases is 3,705, including 122 people who died from the virus. For iAfrica News,